Woman, an in-depth exploration of the world of women today with Sandra Elkin.
Good evening and welcome. The subject we'll be discussing on woman this evening is perhaps for me one of the most difficult we've ever done. It's difficult because, like most women, I'm afraid of it. The subject is mastectomy, or breast removal. Our fear on this subject is very dangerous to us, especially if it prevents us from doing routine breast examination or seeking medical attention as quickly as we should. My guest this evening is Suzanne Johnson. Suzanne has had this operation. Sue, welcome to the program.
It's nice to be here.
Can you tell us when you first discovered you had a lump in your breast?
It was 4 years ago in November. I thought I had a pulled muscle, and when I went to the doctor for an examination, I told him about this pulled muscle, and he suggested we go in the hospital and have a biopsy. This was in early November, and he said, would you rather wait till after Thanksgiving? And I said, no, I just as soon get it behind me. So we went in the hospital, and he explained everything to me and said if the biopsy turned out to be malignant, that he would do a radical mastectomy.
What were your conversations with your husband like at this point? Did you tell him right away?
Oh, yes, I told him right away, and he agreed with the doctor that if it were malignant, that there should be a radical mastectomy. He was all in agreement.
You didn't at that point think of any alternatives like some women are today?
Well, 4 years ago, there wasn't the controversy that there is today on mastectomies. I don't remember them talking about lumpectomies the way they were. They were doing mostly radicals with x-ray afterwards. And so I didn't have to make this choice, and I'm just as glad, because if I had to do it over again, I would still have a radical mastectomy.
Do you remember some of the things that your doctor said to you at the time?
Well, he said that if we take care of this right away, that my chances of survival were very good. And of course, I was fearful and asked him would I be able to go back and lead a normal life, and he said yes, that he had many patients that had mastectomies that did everything they did before.
And then when you woke up from the operation, you discovered that you'd had a radical mastectomy?
Yes, I did. But as I say, I had signed, when I went in to have the biopsy, I signed a paper giving the doctor permission to do a radical if he felt it was necessary.
And at what point did you discover that the operation had been completed and that you had one?
Well, when I finally woke up about 6 hours later, I realized then that he had done a mastectomy, because had it been a biopsy, it would have been over with in a half an hour. So I knew that it took that amount of time. And of course, right after that, he came in and told me and explained to me what kind of cancer I had, and that it was not, he felt it was not the type that would spread.
Were you alone in the room at the time, or was someone with you? What was your initial feeling when you woke up?
Oh, I think it was the same as most women. You feel, did he get all of the cancer, or is it somewhere else in your body? And I know that this is a fear that every woman has. And he explained to me just exactly where it was, and that he felt that he had gotten it all. And my husband was there, and he explained it all to him, too.
You believed him, because I know
Yes.
this is a problem with some
Yes,
women.
I did believe him. I had great faith in him, and I did believe him.
At what point did you tell your children?
Oh, before I went into the hospital, we explained to them why I was going in, and I didn't think we should keep it a secret from them. We told them that I was going to have a lump out, and if everything was all right, I'd be right home. But if not, if I had to have more surgery, that I would be in the hospital for a week or so.
How did they respond to this?
Oh, my youngest child, she was really too young to know the seriousness of the operation, so I really don't think it meant that much to her. But my older two, I think, were quite concerned about it, because I think they had read things in magazines and the paper about mastectomies today. There's so much written.
Did they visit you in the hospital?
Yes, my oldest child visited me in the hospital, and I think when he saw that I was up walking around and everything and looked just the same, that it made him feel better.
Do you recall what your first questions were to the doctor?
Well, as I said, I asked him what my chance of survival was and everything, and that if he felt that he had gotten all of the cancer. I think this is what most women ask right away.
Did you feel that it was going to affect you as a woman at all?
Oh yes, this is another question that women ask right away. I think that they feel that they're going to lose their femininity, and that it might ruin their marriage and ruin their sex life. And I think this is very important in a woman's mind. And he said that this isn't true at all, and that it doesn't have to change your life at all. And it doesn't change your life at all.
Can you talk about the way that you think husbands should respond to this whole thing? I know you feel very strongly that your husband was quite marvelous throughout the whole thing.
Yes, he was very optimistic about it and very positive about everything. I think that husbands should be kind but not be overly sympathetic or act overly concerned about you. They can be kind and encourage you to go back to your normal way of life again, and that the sooner you do that, the better off you'll be.
Did you have long discussions about this with him?
Oh yes, we did have long discussions, and I think he talked me into feeling well again, and to get over any of my fears. And I really think it's very important that you talk all of this out. And I think a man should take the time to listen to his wife if she wants to talk these things out.
What about your friends? Did you tell them? Did you want them to know?
Well, I felt I wasn't going to keep it a secret from them at all, and we told my friends after I had had surgery and everything, and they were all very nice and helpful without being overly sympathetic. And after I came home, I had to go for x-ray for 3 weeks, and they all took turns driving me down for x-ray. And as I say, they were very kind without being overly sympathetic.
Do you think they were afraid also?
Oh, I think so. I think that they probably felt that way, that they didn't want to, they wanted to act perfectly normal with me, which they did.
Did they discuss it with you a lot and express their own fears, or did they just concentrate on your situation?
Oh, some of them discussed it a lot, but if they had fears, they didn't discuss it with me at all. But they, you know, they wanted to know about the operation and everything.
Is the operation a difficult one to recover from physically?
You have trouble with your arm at first, and the healing in the arm can be painful, and moving your arm, sometimes it's hard to raise your arm at first, but it's very important that you do, and that you use it a lot so that your arm doesn't stiffen up on you. But outside it, that's the most difficult part of it, and that doesn't last long. The pain in the arm is over within a week.
So you felt pretty good fairly soon?
Oh yes, physically you really feel very well, I think.
Some women have problem with fluid retention.
Well, yes, sometimes that comes after a radical mastectomy, that you have fluid in your arm. But if you exercise a lot and use your arm a lot, you can keep that to a minimum.
How soon after the operation did you begin to feel better emotionally?
Oh, I'd say, a week afterwards, when I went back home with my family and got back into my normal way of living again, and went out and did things and saw people and began to realize that I could do everything again. I think then being busy is the secret to getting well in a hurry.
Did you have someone that you could speak with about this who had been through it?
No, but my doctor was very willing to talk about it and to answer any questions, and I visited him every week for a month or so afterwards. And as I say, he was very willing to talk about it and give you a lot of time.
Did he introduce you to the prosthesis, or did a nurse or someone else?
No, well, he told me that after I had finished x-ray that I could go be fitted for a prosthesis.
Maybe we had better explain what the prosthesis is.
Oh, prosthesis is a form that you can wear. It fits into the side. They put pockets in a brassiere, and it fits into the side of the brassiere. There are several different kinds now, and they're really great because they fit right to your body. They don't slip or anything, and you feel perfectly normal with them on. And they have a new line of bathing suits that the prosthesis fit into for women.
How would you have not wanted to be treated by your friends?
Oh, I would not have wanted them to be overly sympathetic to me and hovering around me or anything, because that would have made me more concerned. I'm glad that they were all treated me perfectly normal.
You have a job now, and that entails counseling other women who've had this operation. How did you begin that?
About 2 years ago, there was a write-up in the paper asking for women who had had mastectomies to volunteer at the Millard Fillmore Hospital. And when you volunteered there, they sent a form to your doctor for him to fill out, asking if you were capable of doing this. And then after he agreed to it, you went through a training program at the hospital that was set up with the American Cancer Society.
What did they do to train you for this?
Well, they told us what we were to say to patients and what we were not to say. We don't give any medical advice or anything. If a patient asks us anything like that, we tell them they have to ask their doctor.
Sort of talk us through a visit with one of these women.
Well, when we go into the room, we take a book which is called Reach for Recovery, which is the exercises where you reach your arms and everything. There is a temporary prosthesis that a woman can wear when she goes home so that she will look normal and until she can go out and buy her own prosthesis. There is a letter to husbands explaining to a husband what his wife has been through and how to treat her afterwards, that he is to be kind, as I said, but not overly sympathetic to her, and that she can lead a perfectly normal life again. And the patients, you give all this information to the patients, and then there is a list of the stores telling them of the different stores where you can buy the prosthesis. And they're all very interested in that and want to know about the different prostheses, because women, most women don't even know anything about them until they've gone through something like this. And they ask you questions about how soon you felt well enough to go out and do things, and how your family took this, and if they can play golf again or play tennis, and if it affected your life with your family or your husband or your friends. And then you show them how to do some of the exercises, and then you just leave it up to them to ask you questions.
Do you see them only once, or do you see them several times?
You go in to see them once, and if they want to see you again, you go back and see them again, or they can call you up and talk to you, too.
Is there any provision in this program for you to talk with husbands?
Yes, I have talked with a husband. If the husband wants to be there, the appointment is after the woman has had surgery. Her doctor writes on her chart that he would like one of the women to come from the mastectomy program to visit. And they are told, the patient is told when you are coming, and her husband can be there when you come. Mm-hmm. And one morning I did visit a patient, and her husband was there, and he asked questions too. So the husband can be there when you visit.
Are the husband's concerns and questions different from the wives'?
Yes, their concerns, they're very concerned about their wives, but a lot of them wonder if she, when she goes home, if she has to really rest, and if she can lift anything, or if she can... Can you
lift things?
Well, you don't for the first 3 weeks, but mm-hmm. then after that you can, and if they can drive a car, mm-hmm. They ask questions like that. If she
can you drive right away?
Oh, about 2 weeks afterwards, mm-hmm. you can drive. But they want to know all these things, that when she goes home, if she can go back to her general work around the house and things like that.
They want to know how long they have to do the dishes,
yeah,
right?
right, that's it. Yeah.
Are there many programs like this around the country?
Oh, there are a lot of them around the country. I think it was started from maybe 8 years ago. There was a Reach for Recovery program in New York City, and it started there, and this has gone all over the country. And there have been many programs set up similar to this. Sisters Hospital in Buffalo has a mastectomy program, and there are several other hospitals that are starting them. But it is all over the country now that they have this.
Do many women go for plastic surgery after this operation?
Oh, I don't think many women do. I know that it has been done
Did you consider it ever?
Oh, as a joke, I came home and mentioned it to my husband that I thought I'd have it, and he just laughed. He felt it was completely unnecessary. He said it's a lot of surgery to go through for something like that. But as I say, I know that it has been done, but I don't think it's...
It is available, though.
Yes, yes, it is.
Why didn't you consider it seriously? I mean,
Because I really don't think it's that important. My husband said he couldn't see that it was necessary. It hadn't changed our life at all, and why should I go through a lot of surgery for something that was really false anyway? It would be just as false as a prosthesis, and he didn't really feel it was necessary.
what was your social adjustment like? What about the first time you went to a party? Was that very difficult?
Oh, when I went out the first time, I thought it might be difficult.
Was it soon after, or?
Yes, it was about 3 weeks or so, or a month afterwards, and I went out to a party, and I thought it might be difficult, but it wasn't. As I say, the prostheses are so great, and they feel so good on you that you just feel perfectly normal.
Did you feel like everyone was looking at you?
Well, for a moment, but then I knew that they really weren't, you know. I felt when I first came home, my children were looking at me more than anything.
Did you have a prosthesis on then?
Well, it was just the temporary one that you get from the hospital. But as I say, when I first went out again, and I had a new prosthesis on, I really felt fine, and I didn't find it was that much of an adjustment at all.
Did you wear the prosthesis home from the hospital for yourself or for them?
For my children, because I didn't want... I think it might have frightened them if I came home looking sunk in, and it just isn't a normal look.
What are your feelings about the current controversy about radical mastectomy versus lumpectomy?
Well, I know there's a lot written about it today, and there's a book by Dr. George Kreil from Cleveland who writes about all the different types of breast surgery, and he mentions the lumpectomy and the radical and the simple mastectomy. But today I know that a lot of them are getting away from the radical mastectomy. But as he says in the book, it is up to the patient and their doctor to decide what kind of surgery they will have. I have no regrets that I had a radical mastectomy.
Do you wear a bathing suit?
Oh yes, yeah, and go swimming. Because the bathing suits, you can buy bathing suits today. Several of the companies that make prosthesis are putting out bathing suits now that you can wear the prosthesis in, and they look just like any other bathing suit, and you look fine in them.
You told me a funny story that I know we can't tell about the bathing suit.
Right.
If you could make suggestions to husbands as to, some things they might do for their wives during this time, what would they be?
Well, just to listen to her if she wants to talk, and to reassure that she is still attractive, to encourage her to go out. I think this is very important, that they go out and do things again, and to be kind without overdoing being kind.
Can you do everything now that you could do before your mastectomy?
Yes, there's nothing that you can't do.
Like what were some of the things that you did before?
Well, I played at golf, and I can still do that. And I've taken tennis lessons this last year.
That was something you didn't do before.
No, I didn't. I didn't do that before, but I'm trying that now. But there really is nothing that you can't do at all.
What are your fears now? Do you have any?
No, I don't have any fears now. I think as time goes on, you really forget about an awful lot of this, and I just don't have any fears now.
Do you think it's unreasonable that we have this tremendous fear of this operation, that it seems to become such a big issue?
No, I don't think it's unreasonable, because I think today there's such an emphasis on the body and the breast. It's part of our culture today, and I can see why young women today are terrified of losing their breasts, because they think that they lose their femininity.
Do you think society contributes to this?
Oh, yes, I do. Yes, I do.
In the media, perhaps?
Right, right. But I do think that today there's so much written about this, and it has become quite a common operation, that maybe women's fears will disappear.
What is your family's attitude now as opposed to what it is before? Do you feel they're pretty calm about it now?
Oh, I don't think they think about it now at all. I think they don't think one way or the other about it. They really seem to have forgotten all about it, which is the best way.
Did you do routine breast examination before your mastectomy?
Oh, well, I didn't all the time, but I did sometime. But I would suggest that all women do. Every month they should do a routine breast examination.
Did your doctor give you instructions?
Yes, he did. He told me how you do it. But and I think any doctor will take the time, is more than willing to explain this to women. And I think it is important that they do this today.
When you were in the hospital before you went home, and you really didn't have another woman to talk to, how important do you think that would have been at that time?
Oh, I think it would have been very important. I really think, I know that most of the women that I visited are very appreciative, and I really think it would have been great to have had a woman walk in the door who was up on her feet and doing things again and feeling well. I really think it means an awful lot to a woman to see, and who can sit down and talk to you and compare things with you.
At what point do you really feel you began your emotional recovery from this?
Once I was able to go home again and be back with my family and be busy.
You didn't have a job at that time? You didn't work?
No. But I do feel that once I was home with my family and started to go out again and everything, and you get busy, you forget about it. You just don't dwell on it all the time.
Did you invent things to make yourself busy, or did just the normal everyday burden?
Oh, I had an awful lot to do, and I was just busy before, and I was busy afterwards. And I tried to go back to doing things as quickly as I could once I got home.
You said earlier that it was very important, you felt, for husbands and wives to communicate about this. Can you go into some detail about your husband's conversations with you?
Well, we had many conversations, and he was very reassuring, and he said it really didn't make any difference to him at all. He was just glad that I was well again, and he just felt that it was very unimportant that I'd had my breast removed as long as I was well. And it didn't change our feelings towards one another at all.
You were very open with him about your fears and so on?
Oh, yes, very much. And he was very willing to listen to it and very reassuring to me. And I think this is very important to a woman. I think it would be very difficult if she couldn't talk about it with somebody.
Are there husbands, you think, that don't respond properly?
Oh, I think there are a few of them that maybe it takes them a while before they can respond to it. I think they're frightened and they really don't understand. And I just think it takes them a long time to come around. And I think this must be very difficult for a woman, because I think she can recover much faster if she has a husband who is reassuring to her.
Do you think it's important for the husband to express his fears also, or do you think he shouldn't do that?
Well, I don't know. My husband didn't express any fears to me. As I say, he was just glad that I was all right. And I really don't think it would be too wise to express too many fears to your wife before. I mean, after it's all over and you're well again and you're secure again, then it might be all right to tell her that you did have some fears.
And it's probably not very good of your friends to do that either.
Yes, yeah. Most people, though, it's amazing. They don't really say too much to you or anything, and they don't act overly sympathetic to you.
Do you see your doctor regularly now?
Oh yes, I go every 4 months for a checkup.
What advice would you give to women who are afraid and who are possibly about to go for a biopsy?
Well, the first advice I'd give, if a woman finds a lump, that she would go right away and not put it off and think that it's going to go away. She should go and let her doctor decide what to do. And if she has to go in the hospital and have a biopsy and then a mastectomy, if she can just remember that it's not going to change your way of life at all. And if she isn't too fearful, she'll recover faster.
Would you have believed that if someone had said that to you, that it won't change your life?
Well, at the time, maybe I wouldn't have. But as I say, within a week's time, you're up and around and find that you're doing things again, and then you start to believe those things.
Sue, we're out of time. Thank you very much.